Hospitals reporting pregnant people to the authorities. Sometimes there's this mandatory report, I guess. Right? There's so far, I said, wait for it now. Hospitals reporting pregnant people to authorities for meds the hospital gave them. You did this. According to a new investigation by the Marshall Project, hospitals across the country are reporting pregnant people to said authorities for testing positive for medications that the hospital gave them. The report details several examples and stresses that these cases are far from isolated incidents. We got bigger problems than I thought here in America. Let's give you some details. In one heart-rending case in 2023, a Texas woman named Amairani Salinas, 32 weeks pregnant, when she needed an emergency C-section because her fetus was stillborn. As the hospital prepared the mother of three for her procedure, they gave her midazolam. It is a benzodiazepine commonly prescribed to keep patients calm. The following day, while Salinas held her stillborn baby, a social worker told her, not, hey, I'm here to counsel you, any kind of mental health issues you may be having, your baby stillborn. Nope. Told her she was being reported to welfare authorities because a drug test revealed traces of benzodiazepine. Consequently, the state conducted an invasive 4-month investigation into Salinas, all while the report notes that she was still trying to fight off paralyzing depression while processing her grief and caring for her other children. This is stupid. This could have been cleared up in 10 minutes by admonishing a staffer that, instead, 4 months, money spent, and oh yeah, the most important thing, a woman who deserved nothing but emotional support was put through hell. Reveal with the details. Marshall Project also cited the case of an Oklahoma mother who tested positive for meth after giving birth. Her newborn and 3 other kids were put in foster care for 11 days until authorities realized it was due to the heartburn medication the hospital gave her. In New York, an unnamed mother lost custody of her toddler and newborn after testing positive for fentanyl because the epidural the hospital gave her had traces of the drug. One 2022 study found 91% of women given fentanyl in their epidurals later tested positive for it, which means you should know. And if you're investigating these kinds of things, you should know. Report gives further chilling examples of just how easily pregnant or postpartum people can find themselves under investigation by the state or even lose custody of their children over mere misunderstandings. So even if you're clear, this stuff is on your record. This is sick. Marion General Hospital in Indiana did not respond to requests for comment. Brian Heineman, spokesperson for the Indiana Department of Child Services, declined to comment on Villanueva's case, but said policy has since changed to ensure that drug screen results alone are not used to substantiate an allegation of abuse or neglect. Thanks, Brian. Federal law requires hospitals to alert child welfare agencies anytime such babies are born. A previous investigation by the Marshall Project and Reveal found that the relatively inexpensive pee in a cup tests favored by many hospitals are highly susceptible to false positives, errors, and misinterpretation. So, before I read the last part, have you ever looked at a hospital bill? A cheap test that said false positives are great, and they're probably on your bill charging you 50%, maybe 200% markup on it. You can't do any better than this. Many hospitals have failed to put in place safeguards that would protect patients from being reported over faulty test results. Dumb and Dumber at play here, Fran. It just so happens that Dumb and Dumber are affecting the lives of the people who least deserve it. This is a no-brainer. So I have to deduce that someone is perhaps missing a brain.
I mean, this is another instance of violence against women and specifically pregnant women who are facing awful situations throughout this country due to harsh anti-abortion laws that are causing them to bleed out because of miscarriages and possibly die. And now you're having hospitals report them to Child Protection Services, drug test them for the very drugs that they gave the patients, fentanyl, which we talk a lot about. But what's interesting is if you've ever been pregnant or you ever had went into labor, as I know, fentanyl is one of the options, one of the few options when it comes to pain meds that hospitals are allowed to give you. It's legal, obviously. It's not street fentanyl being given to people in labor, but it's fentanyl. And so then to turn around and test for that, to turn around and take a newborn baby away from a mother is absolutely unconscionable. It is wild. And 9 times out of 10, you know who this is happening to? Not 9 times, 10 times out of 10.
Mm-hmm.
This is happening to poor women. This is
Yep.
happening to women of color. We know who this happens to. We know who they would dare remove a newborn child from, dare put into foster care, and who they don't, right? It happens all the time. And this is just another example. Look, and look, while we're at critiquing our entire medical industry and our private health insurance industry, let's critique these hospitals that make also billions of dollars, right? They are massive money makers, right? And they also are not caring for pregnant patients the way they need to. This is another case in point. And it's not to say we discredit all hospital systems. I gave birth in a hospital. I didn't use fentanyl. I did have an epidural. Thank God. Big ups to the epidural. But like, it is not to say we throw it all out, but you wonder why people don't trust medical institutions when this is how they treat their patients. When you have maternal mortality rates going through the roof and Black maternal mortality rates are like on par with, the global South. So it's just, I'm so grateful for the reporting. I am so grateful for the Marshall Project, and I hope this gets national attention,
Yep.
and I hope that people speak to reporters if this has happened to you.
I do too, because as they said, these aren't isolated incidents. There is a war against women, an assault against our bodies, and it is clear. It's clear as day. And they don't care about us. Everything is just sign off, move the paper. There's no seemingly human analysis of the toll it's taking.
Oh,
There seems to be no kind of care and empathy.
yeah.
Seems to be none. Even a social worker. What other signs did you see? Trace amounts of this and that in someone's blood. Were kids well cared for? Like, what makes you? That's abuse of a child, right? Strip them away from their mother, who their siblings dead in the one case. Okay, the newborn's not coming home.
Sure.
So you're going through all of this trauma, and now you're in foster care. And mom is perhaps facing jail or something, but you're not going to be with her. You're with some family who's treating you like you belong in the system. It's sick. I
And
think,
and I mean, and
oh,
this is I just the last thing I have to say is like, look, we talk about child separation when it comes to immigrants and migrants under Trump. That is egregious and wrong and a human rights abuse, but they're doing it to people who are documented. They're doing it to average Americans. Systems have no care for family values, real family values, keeping parents and children together, supporting them in their times of need. Even some social workers seem to have been complicit in these things. So, it's just how the state views women.
yeah, like they're just pushing paper, man. They could care less about your pleas, your cries, your depression. Fighting depression and the law, who you're already thinking, God forbid, your baby's gone. Okay. You've had a major procedure. They were preparing her for a C-section. I had one of those. And now,
Yeah.
hey, here comes the law.